4th of July weekend travel may have revived the COVID threat in the U.S., especially for unvaccinated people who are most at risk from the more contagious Delta variant. About 8 million passengers went through U.S. airports between July 1st and the 4th, nearly triple the number from last year. Errol Barnett is at Washington's Reagan National Airport. Errol, I traveled this weekend. It was a mess.
Yes, Jamie. So you were among the hundreds of thousands of people who traveled through airports like this one at DCA this holiday weekend. And all of this travel is happening right after the Delta variant had been doubling every 2 weeks. It had also popped up in all 50 states, and that preceded this recent holiday scramble. There was a real sense of revelry on the 4th of July as an estimated 48 million people left their homes to celebrate.
It's good to be free again without the mask, at least outside.
But the growing threat is the Delta variant of COVID-19. It's 40 to 60% more transmissible, with indications it may cause more serious disease. It now makes up more than a quarter of all cases nationwide.
All this travel this weekend mixes people up. The Delta virus is traveling also, so it will be introduced everywhere.
Dr. William Schaffner is an infectious disease expert at Vanderbilt.
We may indeed see cases start to go up again, along with hospitalizations, and then down the road, once again, deaths.
Yesterday, California announced the Delta variant is now the dominant strain in the state, making it at least the 5th state where the new strain has taken over. In places like Arkansas, Wyoming, and Nevada, where full vaccination rates are below 50%, cases are once again spiking. Nevada Governor Steve Sisolak is trying to buck that trend, with his state leading the nation in new COVID cases.
$5 million in cash and prizes for nearly 2,000 eligible Nevada residents who have been vaccinated.
This gamble could help as long as people get their second dose. In Texas, for example, more than 1 million people skipped their second vaccine appointment, which is about 9% of those eligible. And that's why we have to underscore this pandemic is not over. That low vaccination rate, or people who only have one dose, really does have health officials concerned. Consider that in a recent UK study, it found that the efficacy rate of the Pfizer vaccine drops to 33% for those who only have one dose, jumps up to 88% for those who have 2 doses, and for the vulnerable, that really could be the difference scale between life and death.
Yeah, keep saying the numbers, Errol. It makes sense to complete the process once you start. If you're supposed to get 2, please get 2. Thank you very much, Errol Barnett.